the stress of depression and anxiety. This is a sensitive subject, honestly speaking, and I want to say hi, good morning, good day, wherever you are. My name is Mabina Daniel Lingwayne, your holistic health and wellness coach. I'm so excited to share with you this. This is the month where we mark the mental health. A lot of people, especially in this time of 2020, it's going to be that year. A lot of people, they might face a lot of challenges. There might be a lot of prescription happening between, doctor's office, and I wish there was a way we could deal with this better. But today, I hope my video will be able to help you in understanding the best way you can handle your stress level and depression and anxiety and chronic fatigue and mood swing and lack of sleep. So most of the thing I could think of that they can, put you in a stress mode or depression or anxiety or mood swing, or it might be maybe lack of motivation, or maybe short-tempered, or being aggressive, agitated, things like that. We can go on and on and on. Lack of sleep, maybe you will have slept and you still feel tired, you don't know what's the problem. Or maybe you fight with your wife a lot, or you fight with your husband or your other half, you keep on fighting a lot, we don't understand. Hey, listen, sometimes it might not get to do with your girlfriend or your boyfriend or your wife or your husband. The question we need to ask is that, how often are you eating healthy? I mean healthy, I don't mean like, you're trying to, I mean like eating like 5 to 7 cups of vegetables, taking maybe 4 to 6 to 8 spoons of olive oil, and maybe you have things like flaxseed, chia seeds in your meal plan, if not bread, if not pasta, if not rice, if not Coca-Cola, if not alcohol, because it have been proven lately now because of COVID-19. We tend to see a lot of people turning into substance abuse, where alcohol, it have increased so much abuse, and also other substances. But that's not the subject I want to touch today. Today I just want to touch the subject that I think can help you to be more rational with yourself when coming to fix all this problem of, sometimes I used to not be aware of myself, but thank you. Lately, in the past few months, I'll be studying a lot and then doing a lot of researches, and then getting to understand the causes and the things that they can hamper your health when coming to malnutrition deficiency. And a lot of antidepressant medication which has been prescribed, I don't think, or prescribed to patients. Sorry, I'm not a doctor, to give this advice maybe, but as a nutritionist, or as a nutrition and weight management, and as also a diabetes fitness training coach, I think I might be in a position where I might throw my 2 cents away, because I deal with a lot of patients who have, or a lot of clients who have a high blood pressure, who have cholesterol issues, who have anxiety, who have diabetes type 2, or who have other conditions which I'm going to tell you now. So, but now I just want to talk with you. What is the best way you can think of? Look. Most of the time, the things that I know is that, like, let's look at me. I used to live in UK, and I used to be in a lot of bad mood and depressed and anxiety. I remember my skin started changing. I did have eczema. I have a lot of things. I never have them. And I think homesick as well was the other thing contributing to the factor of that. I was not around people that, care about me, love me. And oxytocin, it was one of the chemical I need. There's nobody to hold me and reassure me and say, hey, Daniel, listen, it's going to be okay. Oxytocin is one of the most important chemicals. We get it when we live around with people who kiss us, who cuddle us. Like children, they get a lot of oxytocin because when we see them, we touch them, we hug them, and they get so much. Sometimes they get small doses, they high doses, depend who are they with. If you're a jolly person, you have energy. That's why the children sometimes they can cry when they are lifting up by somebody. They can be bubbly. It's kind of energy that oxytocin releasing. Sometimes you can sense it. That's why people, when we cuddle them, we hug them, they feel the love, they start feeling much love, and they can get better when they are surrounded by us. So now you could see the people we lose, some of them due to COVID or whatever they might say. I don't want to mention names, I might get in trouble. And I'm sorry if maybe you lost your one because of the situation we are in, or maybe what is going around the world now, being isolated and not having a chance to be with you and feel your love. Because I believe maybe if they could have been with you, around you, there could be more justice being done of, a reassurance, and seeing you, they get that oxytocin I was speaking about. But that's not about the oxytocin here. The thing that I want to speak about is like things like low deficiency of vitamin D. I told you I used to live in UK. In UK, the sun, I used to see like maybe the sun, I don't know, was maybe around 9 o'clock, 8 o'clock. It can come maybe for 2 hours. By the time I'm trying to catch, when I was at the workplace, I could not catch the sun because I was working, or maybe I would try to go there, get 5 minutes, and the next thing I know is back into the cloud again. I was used to be upset and I used to be moody, and I did not know what's wrong with me, what was going on with me. I wish somebody had told me earlier that I need more of the sun exposed myself, but the way I was so moody and not loving UK and not loving being around everybody else was not because the people were not nice or the environment was not nice. It's just only the environment that I was in was not a purely good environment. So look at it this way. If you know that your low deficiency of zinc or chromium is going to impact your health really very much, in the smell, in also the taste of the food, it really matters. Other thing I can think of, if you have a high cortisol of stress, it's going to impact you, how you think, how you feel, because your cortisol also is part of the cholesterol. So if you don't get enough cholesterol, or maybe if you are less than 160, it might be another problem. I'll say, please, before you do anything else, you need to go and check with the doctor. Your doctor is the one who can really help you, or do proper tests. All these things I'm sharing with you, you need to go and check with the professional medical practitioner who can help you to analyze and get the exact results. Other thing I could think of is your B1. B1, we get it in a lot of animal product. The plant that I could think that can give you B1 is wheatgrass. Wheatgrass is having microbes that you can get them, that they produce B1, but not in that large amount of what you might need. What you might need, you might get it from animal things like liver, like chicken, like pork, like fish. It produces that a lot. Other thing I can think of is maybe you might need to increase, or maybe to think of looking at eating fish, or increase your omega-3, because it helps in improving the joints and the bone and the muscle tissues, and it helps you also in being able to sleep, because if you don't have enough of those things, you're not going to be able to sleep. So that might be one thing that you might consider. Well, also for your brain, fatigue, it might be something that you might have a problem with, because you need to make sure that you get a lot of oil to help with your brain. Remember, your brain is made up of 90% of fat. So if you get to be deficient of fat, it might be a little bit of a problem for you. Other thing that I could think of is the medication side effects. Like people who tend to take statin, they might have a lot of depression a lot of time, because CQ10, which is in the cells, in the mitochondria, it might deplete because of medication. That's why I say be careful with the medication you're taking. Other thing I could think of is your digestive enzyme, because the medication, they kill the digestive enzyme. Your liver have its own digestive enzyme, your stomach have its own digestive enzyme, your heart have its own digestive enzyme, your muscles, they have their own digestive, the brain, everything have its own digestive enzyme. Even if the pH of the body is like 14, each body part, muscle, livers, the body, the blood, it have its pH of 7, totally by 14. Around your stomach, it have between 1 to 3. That's the ratio of your pH balance. So it has to be. Other thing, vitamin D3, it might be something you might have to go and check with your doctor. How often are you exposing yourself in the sun? That's the question you need to be asked yourself. 15 minutes to 10 minutes can yield about 15 to 20 IU, international units, of vitamin D3. So if you spend like roughly 30 minutes outside the day, you might get 30,000 very easily. So I will spread it maybe in the morning between 6 a.m. to 8 a.m. I go 10 minutes, 15 minutes to get 15-20 minutes, 20,000 UI of vitamin D3, and later on after I can go and do the same thing to get vitamin D3 of between 15 to 20,000 UI of vitamin D3. But I recommend you, when you take this, make sure you take a K2 so you can lock it in. So because it works better, it's more efficiency if it have K2, they work hand in hand. Other thing I could think of, just not to help you or to help you so you don't get to be depressed more. I told you omega-3 with the DPA is DHA as well. It can be another source that you can think of. EPA as well, you find it essential fat, EFA, essential fat acids. Those are the things that you should think of. Avocado, it might be other thing, you might be flaxseed, chia seeds. Those are the things that you should be focusing on when you eat your food. And pomegranate is as well, it might be helping you because it's rich in antioxidant to help you protecting osteoporosis, depression as well. If you have a stomach problem, remember yesterday I spoke about the gut and the brain, how much they're connected. So pomegranate helps you with that inflammation, help with the colon, digestion, nervous system, the enzyme. They're very important in linking because all your receptors are linking in the gut. So that's where you get a lot of nutrients. Also, magnesium, it might be one element you might have to consider for you to help you to relax. But magnesium, last time I did a video, I told you it works hand in hand with the potassium. So if you look at what is the highest, banana contains around 400 mg of potassium. So you might have to look at avocado. Avocado is the highest source of potassium. Also fiber, if I think of, and it's good. It's make you feel satiated very easy, and it suits the microbiome or the stomach inside. It's good for your hydrochloric acid in the stomach. So I recommend avocado. It has so much nutrients inside that you can look into. Potassium, you need between 3,000 to 4,700 mg. So you need between 5 to 7 or 10 cups of green vegetables. And it's kind of a precursor or a builder of you to help you to relax. So I will say if you are looking at maybe now to start helping yourself to be more relaxed, potassium and magnesium are best combination I could think of. That's why some of my clients, I recommend them if they're struggling to sleep in the night, they might have to take a sea salt, just a quarter of a teaspoon in the warm water and drink it and read a book. It knocks them off and they sleep very peacefully. So you too, I think you can try these things, are not complicated, but the best way that I know is going to work for you if you're trying to get to, help yourself with the depression, anxiety, all mood swing, all this schizophrenia, dementia, Alzheimer, all these things, Parkinson's diseases, multiple sclerosis, high insulin resistance, high blood pressure, they will link with all in all with depression and causing or leading to that. So your diet, removing sugar out of all your food, reducing alcohol, removing all these carbs that are not healthy, that your body struggles to break, which are simple carbohydrates, they might do justice for you. So think of having complex, and then be complex are the most important thing I would say. If you know that you're not taking any supplement or you're not eating healthy and you're working on a high toxin stress level environment, be complex, it might be a way for you to go forward. So just go and try to get B complex. They have B complex normal, B50, B100, depending. B50 means everything is going to be on 50 mg. B100 complex, everything is going to be on 100. That's the way how it goes. These are things, I'm not going to recommend any brand because I'll be selling something that I don't know, but I use my own, but I'm not going to quote the names because it will be wrong of me. Well, there's brands out there which are good, which I would say just go and try yourself or ask your doctor, or if you want to talk with me, maybe let's sit down and have a chat and let's see what are you doing, and maybe I can help you, I can suggest what I know. So I hope this video have hit home, it have helped you to understand the mental health and your lifestyle and your food, or the things that you've been thinking that might be causing you to be depressed. It might not be them or people you think, but I would say if possible, move away from the energy suckers, vampires. Move away from the vampires. They will take your energy, they will destroy you. Walk away from them. And also your environment where you are, it can impact how you feel. Try to move away from the environment that suck out your energy because it's not healthy for you. So guys, I hope this video it have hit home. We celebrating, or we trying to recognize the mental health issues that our community are facing, challenges. I will please appreciate if you can share this video because it have a lot of information that can help other people. Thank you very much for watching this video. Like, comment, share, and it will be nice reaching out, or you connecting with me. My name is Mabina Daniel Lingwen, your holistic health and wellness coach from Vega Energy Personal Coaching Services. Thank you.